Welcome to the May 6th meeting of the Rotary Club of Ames. Please stand for the Pledge of Allegiance. Please remain standing for individuals or families we would like to keep in our thoughts. Is there anyone in our Rotary family that we should keep in our thoughts? If not, let's please keep the families and victims in your hearts that were affected by the display of hate and the shooting that occurred in Buffalo. And while you guys take a moment of silence, I'm going to say a quote by Nelson Mandela. No one is born hating another person because of the color of his skin or his background or his religion. People must learn to hate, and if they can learn to hate, they can be taught to love, for love comes more naturally to the human heart than its opposite. Nelson Mandela. Be seated. A few guests did sneak in today, so at this time, if John can take the microphone to Mike Roof in the middle there.
Good afternoon. I'd like to introduce my wife, Jill Ruff. You're supposed to stand up. Jill is a 30-year plus employee of Mary Greeley Medical Center, currently worked in the lab for most of her career, currently in the wellness and rehab area. She's also the president of Planet Roof, an event planning business. So shameless plug for all of you looking for somebody to host. Those of you fortunate enough to, or maybe unfortunate enough to visit a Test Iowa Center, the gowned up lady in the moon suit with crazy hair, that was Jill. And she's also president of the Roof family household. And so she's raised 2 kids and keeps me in line.
And Rosa has a guest today.
Thank you. I would like to introduce today my friend, Emily Hager, friend and colleague from the ISU Foundation is visiting with me today. She currently is the Assistant Vice President and Controller at the ISU Foundation. In July, though, she will become the next Chief Financial Officer at the Foundation and will join this group. She will replace Lisa Esslinger, who's retiring on July 1st.
Okay, it's always nice to have visitors. Welcome to you from Ames Rotary, Naveda, London, or Gay Paris. From far off lands or the USA, we're glad that you are here today. Come back again whenever you're near. Join us and then we'll make it clear. Around the world you will always be welcome at Rotary.
Okay, now we have a couple of new members to introduce. If you guys would please come forward with your sponsors, that would be wonderful. Paige, if you want to go ahead and introduce Kim first, you can just.
All right, we are excited to have Kim Schilling as our new CEO at Bethany Life in Story City. Kim was the Vice President of Health Services at Friendship Haven in Fort Dodge, where she served as the facility administrator. She provided oversight for all staff members, as well as a 155-bed skilled care unit and 104-bed assisted living community. Kim received her nursing home administrator license in 2013 after completing her MBA in 2008. Kim said, "I am humbled and excited for the opportunity to serve the Bethany Life organization. Together, we will continue to create a culture of compassion and quality of care for our residents, tenants, and members. We will remain a strong leader in the aging services and deepen our foundation of faith." Bethany Life is known in the industry for being innovative with health services, and we know that will continue under our new leadership with Kim Schilling.
So I am introducing Anna McCracken, the founder of the Ames Writers Collective. Anna founded the Ames Writers Collective in 2021, whose mission is to bring together writers and readers of diverse ages and cultural backgrounds to celebrate the essential art of the written and spoken word while advancing the literary arts in Ames, Iowa. Writing Circle Wednesdays, a community outreach program for individuals receiving and recovering from cancer treatment and held in partnership with the Bliss Cancer Resource Center, was launched in March. The center will be located at 409 Douglas as soon as renovations are completed. Okay. Anna received her Bachelor of Science and Master's of Fine Arts in Creative Writing and Environment degrees from Iowa State University. She just graduated last year with her Master's of Fine Arts. Anna is currently seeking agent representation for her thesis, Redacted, a memoir of adoption. Her personal essays and poetry have been published in various publications. So how did Anna get back to Ames? In August of 2015, while attending an Iowa State Alumni Association board meeting, in her free time, Anna had been driving around Ames, wondering what it would be like to be a resident of Ames again. As luck would have it, that very board meeting, Jeff Johnson announced that the owner of a then two-story ranch house at the corner of Keelty and Beach wanted the Alumni Association to purchase the house and make it into a bed and breakfast. The board, of course, voted the purchase down, but Jeff Johnson helped Anna to make an offer, even though she was still living in California at the time. In 2017, Anna and Ed relocated to Ames for several reasons, but Anna's main reason was the desire to be surrounded by greenery and rolling hills of corn, open landscape with long stretches of highways, and for a sense of community, something she had not found while living in Palo Alto or San Francisco, California. Community to Anna is all about standing in line at Wheatfield, chatting with strangers, or running into a neighbors and friends at restaurants or Hobby Lobby. Community to Anna is somewhere where you can feel your impact, watching the smallest endeavors ripple into the lives of community members. Community is about feeling welcomed with open arms to get involved, to create dreams and watch as they become reality. All of these things Anna has found in Ames. And lastly, Anna likes to tell people that yes, she did move back to Iowa for the weather.
And you can stay up here. Allison Walters will provide the charge.
Well, thank you. Welcome to the Rotary Club of Ames. Whenever they give me the microphone, I like to take the opportunity to talk about what I consider the hidden gems of Rotary, and that is Rotary Fellowships. They're organizations that bring people together under a common interest or a common passion. Being part of a fellowship is a fun way to make friends around the world, explore a hobby or a profession, and enhance your Rotary experience. There are over 40,000 Rotarians and others that are members of fellowships across 150 countries. Fellowships consist of members who share common interest in recreational activities like 4x4 vehicles and RVs, or sports like pickleball, scuba, golfing, or my favorite, skiing. And I happen to be the international president for the International Skiing Fellowship of Rotarians right now. Thank you. There are fellowships for hobbies, for collectors of dolls, stamps, or rare books, or professions such as executive managers, graphic designers, lawyers, editors, or entrepreneurs. And then, of course, there's the ever popular rum, whiskey, wine, and beer fellowships. These groups help expand skills, foster vocational development, and enhance your Rotary experience by exploring interests while developing connections with Rotarians from around the world. At the same time, they also enhance Rotary's public image. Fellowships function independently of Rotary International by establishing their own rules, dues, and administrative structure. Membership is open in fellowships to anyone interested, and it's a great way to introduce somebody to Rotary by introducing them via an activity that you know they are passionate about. There's over 103 fellowships listed on the Rotary website today. So take a look, and then you can reach out directly to the fellowship that interests you. And that is on the Rotary website, rotary.org/fellowships. So I hope that you will take advantage of this opportunity to go beyond this club. We're excited to have you here, and we're excited to have you get involved. So thank you and welcome.
Thank you, Kim and Anna. You can safely go back to your seat now. I think Roger had an announcement. Yep, there you are. Also, another volunteer opportunity on Saturday to coach one of the teams from 8:30 to 10 a.m. John Christie is volunteering on Saturday. Last Saturday. Yep. If you guys have any questions, talk to John. He's a professional. Okay. Move on to the main event. Now I'll introduce our speaker. Mike grew up in Knoxville, Iowa. He has 3 degrees from ISU in microbiology, veterinary microbiology, and immunobiology. He has over 40 peer-reviewed publications and over 20 U.S. patent applications. He's spent over 25 years in the industry, focused on vaccine research and development, and has licensed vaccines in the U.S., Europe, and China. Since 2020, has joined the ISU as a chief technology officer, focusing on vaccines and immunotherapeutics and helping commercialize ISU technology. Welcome.
Maybe it's not that impressive, and if you don't believe me, ask Jill. So Karen, do I need to do anything, or you manage it? No? It's on my screen. There we go. Well, good afternoon, and as always, it's a pleasure to be here talking about something that I'm passionate about, and hopefully you can stay awake for the next hour if it's not too techy. But Kelsey already gave my background, but the thing I would say is that for some reason, I'm just sort of a vaccine junkie. I just love this stuff. I love the fight between the body and the immune system and all the infectious diseases that target us every day. And so I've spent my whole life doing that, and I'll probably spend the rest of my life doing it. It's just something that I'm passionate about, and I always find a way to stay involved in it. So just quickly as a definition, so people know what we're talking about, a vaccine in its simplest terms is a preparation that's introduced into the body and used to stimulate the immune system. And so in a simple terms, that's what it is. And immunity is the response that your body gives that provides protection against that agent. And the word protection is subjective. And so what I think is protective and what you think is protective might be different. You know, sometimes protection means you get less sick than if you wouldn't have been immunized. And sometimes protection means you don't get sick at all. It's perfect. But every vaccine's different. And so when people say they got vaccinated or immunized and should be protected, protection's different. And it depends on the disease and it depends on the vaccine. So why do we vaccinate? The obvious reason is to protect ourselves. Protect us from getting sick, protect us from going to the hospital, or sometimes protect us from dying. But there's lots of other reasons to get vaccinated that maybe aren't so obvious. On the animal side, we vaccinate animals for animal welfare, so they're healthy and happy, and we also vaccinate for food safety. We have the safest food supply in the world in the US, and a lot of that's because of the vaccines that we use in our animals. Sometimes vaccines can prevent or reduce the shed or spread of the disease, and many of you have probably heard about that with COVID. In some cases, and go polio, we can use vaccines to eradicate diseases, which is amazing. Smallpox would be an example of a disease that outside of biological warfare doesn't exist because of vaccination. And then some other things, if you're really young or you're really old, sometimes your immune system doesn't work at its full potential, and so vaccines help there. And it's also, if you read the media today, we're trying to limit or reduce the amount of antibiotics that get used because of antimicrobial resistance. And so vaccines are a tool that we can use to help reduce antibiotics. So I'm going to give you sort of two techie slides, and if you're interested in this, pay attention, and if not, eat your lunch real quick. But it does provide some context to the rest of the talk. So there's two types of immunity. One is innate or non-specific immunity. And this is immunity that you have all the time. It's turned on, and it just non-specifically fights disease and agents. And so non-specific immunity could be your skin, just barrier. It could be some of the secretions in saliva. It can be the respiratory tract. So there's just non-specific immunity that we all have that allows you to fight off pathogens and viruses that you're breathing and exposed to all the time. The second part of the immune system is the adaptive or acquired, and that's the one that we think about and talk about the most, because that's the immune system that's disease specific and kind of gets turned on and ramped up, and really the immunity that you want because it provides full and broad protection. One more techie slide. On the adaptive side, there's two different types of immunity that can happen. One is called B cells or humoral. And so B cells, like if you're exposed to COVID, for example, antibodies are secreted. And the way I think about antibodies are, they like attach and form a net around the pathogen. And once the net's around it, the pathogen can't do its job and cause disease. So antibodies are the net. T cells or cellular immunity are like the knights in shining armor. They have a lance and they kind of poke holes in cells and kill them. So there's two different ways that the immune system can work. When both are activated, that's the best. And some vaccines only trigger one part of that immune system. So B cells are the net, T cells are the knight in shining armor. So this slide just shows how those two parts of the immune system work together. The first little bump there, that's innate immunity. So from 0 to 14 days, if we were exposed to COVID, or if the potato salad is contaminated with salmonella, we have 14 days where our immune system is keeping us alive. That's turned on and it's going. The pink line, that's the adaptive immunity. And so that's the immune response that's pathogen specific. It gets turned on, and you'll see on this graph, it's low and slow. So you hope that that lasts a long time. And depending on the vaccine, sometimes it lasts weeks or months, and sometimes it lasts years. But that's what that graph represents. So now I just want to talk a little bit about the different types of vaccines that we all get, and you get, your kids get, and how they're different and why they're different. So an inactivated or killed vaccine is the simplest, cheapest, and easiest vaccine to make. They've been around for years and years and years. And if you're in a vaccine company, you have big fermenters, you grow up the pathogen, you kill it, it's totally killed. You adjuvant it and formulate it. Typically, these are given by needle. Typically, they require multiple doses. The immunity in a killed vaccine is typically that B cell, that antibody net. And so it drives only one part of the immune system. And so some examples that are routine in this room would be flu, rabies, and polio. So and the pros and advantages of killed vaccines are they're safe. Because they're killed, you know, they aren't going to cause disease, so they're just safe. The cons are sometimes you have to give multiple injections, and sometimes you'll get a sore arm. And so these would be examples. Polio, which certainly is something important to this organization, and flu are common killed vaccines that many of us receive on a routine basis. And you can't help but give a plug to Rotary because of End Polio Now and the entire campaign that this organization has supported. This disease is largely eradicated. I did check before. I think, to my knowledge, there's only been 2 documented cases of polio in the last 5 to 6 years, and they were both in Afghanistan. So we are 2 cases away from global eradication. And so, you know, kudos to the entire medical community as well as Rotary for supporting and really eliminating this horrific disease. So another type of vaccine is called a toxoid, and toxoids are generally limited to just bacterial infections. And so bacteria, by their very nature, when they get in the body, they secrete toxins, which cause the disease or symptom that you all exhibit. These are also killed or inactivated. And so typically they do require multiple doses and can have injection site reactions. Again, their immunity is that antibody based, that net. And some examples of this would be diphtheria, tetanus, and pertussis. So these are all toxins. And tetanus toxin, for example, that vaccine lasts quite a while. Typically, if you go out and step on a rusty nail, your doctor will say, well, when was the last time you were vaccinated? And if it's within 7 years, they usually throw a Band-Aid on and send you home. And it's after 7 years, they usually recommend a booster. One thing I forgot to mention on the killed flu vaccine, I love when I hear people, I got flu vaccinated and now I got the flu from it. Doesn't happen. You might have an injection site reaction, but I've had more than one hallway argument about whether you got the flu from the flu vaccine or not. The next type of vaccine I want to talk about is live or attenuated. This is really where I spent almost my entire career. I love live vaccines, and the reason is you generate both immunity to T and B cells, so you get the full immune response. Now, they're a little tricky because they are live, so there are some downsides to them, but typically these are weak or attenuated, and so they're able to infect and replicate, but they don't cause disease. And that's the art of making a live vaccine, is finding that balance of safety and efficacy. These oftentimes can be given in a single dose, so you don't have to do the repeated dosages. The immunity is often longer and often broader. You can also generally give these by different routes other than a needle, which for third world countries and kids is very popular, to be able to give an oral or intranasal. And we have a wide variety of examples. So measles and rubella, which your kids get. There is a flu vaccine called Flu Mist. If I had a choice, I would get this. Unfortunately, I aged out. Once I hit 55, they won't let me get it anymore. But that is a live flu. And back in the day, polio. We used to have a live polio vaccine. We don't use it in the US anymore. I think when I was a kid, they put it on a sugar cube and went around to first grade or something, and we all ate sugar cubes. And that was a live polio. One interesting story, if you're a lab nerd like me, in the 1700s, Edward Jenner, who's largely thought of as the father of immunology, was the first person to really discover immunity, and he did it inadvertently through a live vaccine. And Edward was Danish, and apparently back in the day, not to be sexist, but all the people that milked cows were women. They were called milkmaids. And milkmaids routinely got sores on the arms. It looked like chicken pox. They were scabs. But it was annoying, but it was a relatively mild disease. And Edward discovered that if he would scrape the scabs of cowpox, which was what the disease was, and give that to another person, and then come back later and infect that same person with smallpox, that they were immune. Can you imagine the FDA approving that experiment? But anyway, that was, he was basically the person that began the immunization and control of smallpox, because he would collect scabs off of milkmaids who had cowpox that then cross-reacted and protected it against smallpox. So that's lab nerd fun. Another type of vaccine that's a little more sophisticated are called subunit vaccines. So in a subunit vaccine, a molecular biologist would clone a gene of a specific part of a virus or bacteria, put it inside a vector system, express that, and create large vats of protein. And so instead of injecting the whole organism, now you're just injecting a single piece of protein. These generally are injected as well. These generally induce antibodies, the net. They're again very safe, but do require multiple doses. And one of the most recent vaccines licensed in our country that if you have young kids, probably physicians recommend the Gardasil, which is the human papilloma virus, which prevents cervical cancer in women, and also recommended for boys as well. But this is a subunit vaccine, and it's next generation technology, and more of our vaccines will look like this in the future. Similar to the subunit, a vector vaccine is slightly different. So the subunit, again, is a protein, but it's an inactivated protein. A vector, when they put it into the expression system, they leave the vector alive. So it's sort of like an attenuated live vaccine, except that the protein that's being tested is left in the vector, and the vector is alive. This has the advantage, similar to the live vaccines, of both types of immunity, which is positive, and also sometimes different routes of exposure. So sometimes you can avoid the needle, and can be very long immunity. And as a matter of fact, one of the COVID vaccines from AstraZeneca was called an adenovirus. The adenovirus was the vector that delivered a COVID spike protein. And so that's the most recent example of something licensed, and due to COVID, something we all know about now. And then finally, 3 years ago, I would talk about this, I'd get a bunch of blank stares, and now, thanks to COVID and the media, you're all experts on this as well. But RNA and DNA vaccines have become a reality. I started working on RNA DNA vaccines in the year 2000, and they worked, but they were so expensive that it cost $1,000 to immunize a mouse. And so it was cool science, but it was nothing practical. And because of COVID and all the subsidies that the government's put into it, not only is it viable, but that technology is now going to be applied to more and more things across the globe. So if there's an upside from COVID, that might be it, the investment of some new technology that will provide new solutions. So in this case, and you guys probably all know this from the media and the stuff that you've read, but you're not injecting the organism, and you're not even injecting the protein. You're injecting either DNA or RNA, which is the building block to make protein. And so that goes into the cell and your body becomes the manufacturing site for the protein. So really cool. Again, has the ability to do both types of immunity, B cells and T cells, which is very positive. It's safe. That DNA, it's so small and so targeted. It doesn't create any Frankenstein stuff. It just goes in there and does its job and then gets degraded. As you've seen from COVID, it may require multiple doses. Those small little fragments only can do so much because they do get chewed up. The half-life of RNA is seconds. So that's why it is cold frozen and has all of the, they call it liposomes and nanoparticles to stabilize it. There are some injection site reactions, and as I said, it's very expensive. I am told that the Pfizer vaccine, the cost to make that is $20 a dose, which by human standards is pretty high. Typically, a human vaccine would cost $1 to $5, so $20 is a lot. And it's only available to us because of government subsidies, which we all appreciate. So this is just a schematic of how that works. So the RNA, the DNA, that's the building block. It goes into a cell, and that's the real trick. That's the technology trick that all the vaccine companies have figured out, is how to keep it stable and how to get it into your own cells. And then once it's in the cells, then your body thinks it's just DNA that they have, and it just makes COVID protein. And that's it. So it's really eloquent, but there was a lot of science that went into that one step of getting it into the cell. So I've given you all human examples, but the reality is the same technology is also used in animal health, which is where I spent most of my career. So if you raise cattle or swine or chickens, the same, except for the RNA DNA vaccines, all of this technology would be something you would use on a daily basis as well. And I suspect in the next few years, there will be RNA DNA vaccines in animal health as well. So just a couple terms. So we've talked about vaccines, but maybe some explanation of why we do what we do during a pandemic. So one of the terms that you hear a lot was herd immunity. So what is herd immunity? If you're a statistician, you'll love this, because herd immunity is basically just statistics. The more people that are naive and not immune, the more a virus has chances to spread and shed. And every time a vaccine or a virus moves from one person to another, it creates diversity. And that's the diversity that is a problem for us when you try to get immunity. And as you've seen from all the variants of COVID, having an entire naive population where virus moves, that's the problem. So the more people that you can get immunized, the fewer chances that virus can move. And the fewer times it moves, the less time it has to change, which gives us a chance to actually control it and stabilize it. So when they say herd immunity, that's what that means. It's basically, there's very few places for the virus to jump to, and if it can't jump, it can't change. So herd immunity is very important. You know, another thing that we talk about is the quarantine and the booster. Well, why do we do that? This graph nicely summarizes that. When they tell you to be in quarantine, what do they tell you to be in quarantine for? It's 5, 6, 7, 8, 9, 10 days. That's the time period when innate immunity is active, but your adaptive hasn't kicked in yet. So that's what they're doing. When they tell you to go sit in your room and read a book and stay inside, they're buying time for your immune system to ramp up into that adaptive immunity. And the booster, when they tell you to get a booster, as you can see, the adaptive, those curves always drop. So those boosters keep it higher longer. So that's what we're trying to do with quarantines and boosters. And so, you know, I'm a big proponent of vaccines. I spent my whole life doing it, but there are risks. You can't ignore the fact that every time you stick a needle in your body, something not desirable can happen. And so the most common things that happen when you get immunized are sometimes there's pain and swelling at the injection. Sometimes you'll get a fever. Sometimes you get chills, tired, headache, muscle aches. None of those are great. You don't want them, but I will tell you that all of those are a sign of your immune system doing what you want it to do. So, that's when your immune system kicks on and releases cytokines and cells get activated. Those are all signs of a healthy, robust immune system. On rare occasions, you can get severe reactions, difficult breathing, face swelling, rash, dizziness. If any of you, when you get flu vaccines, oftentimes they'll ask you if you've reacted in the past or are allergic to eggs. I don't think it's done very much anymore, but at one time, most flu vaccines were made in eggs, and egg proteins are really reactive. And so that was when people said they got the flu, they were reacting to eggs. It was an allergic reaction to eggs. So, I will tell you this, that despite the fact that there are risks to getting vaccinated, when the FDA and the government licenses a product, they have determined that the risk reward is like this, not only to you, but the population around you. So it's well characterized. A couple other words and terms I just wanted to throw out because you hear about it in the media, and it's typically talked about with flu, but it's the same with COVID now, and that's antigenic shift and antigenic drift. So antigenic shift is where two different viruses come together and sort of form a new virus. Be the same type of thing, but if somebody from Europe comes to Ames and has dinner with Dan Culhane and they both got COVID, those two COVID viruses might get together and form something different. So that's an antigenic shift. In contrast, antigenic drift would be just this change that the virus does as it goes from person to person. They're built to change. That's how they survive. And so those are terms that you'll see in the media, and that's what those mean. So getting a vaccine licensed is a really complex thing, especially on the human side. And this is a slide that's, I won't even bother going through the details, but this one simple slide probably represents a 7 to 10 year pathway. And so on a typical case, it does take 7 to 10 years to get something through the FDA process and cost well over $100 million. And the very first part of that entire process is all focused on safety. Safety. They don't care if it works. Is it safe? Is it safe? Is it safe? There's a medical term, do no harm. And that's the focus. Is it safe? Is it safe? And once you've proven it's safe, that's fine. Then they'll let you begin to discuss whether it works and is efficacious or not. But that process takes a long time and it's very expensive. The COVID process, or COVID example, there is an accelerated process. And that process doesn't remove any requirement at all. So when people say the vaccine isn't safe because it hasn't been tested enough, the difference between the regular process and accelerated, they all the same studies, everything happens, but instead of being sequential, it happens concurrently. And so, to our government's credit, there is and they don't use it very often, but there is a process, and we all lived through it with COVID, that can get a license to us in less than 2 years. The exact same process, the only difference is it goes concurrently. So all the same studies, all the same testing. So you should feel good about anything that the FDA approves, despite it going through an accelerated process. This slide probably just entertains me more than anything. This is a diagram of all of the licenses, patents, and agreements that one company had to do to get a COVID license. So I told you, there's all kinds of different technology. Well, one company didn't develop that technology, about 20 did. And so in order to legally sell and commercialize a product, there was a lot of lawyers involved to get that. And that's just part of the vaccine world right now. With new technology and all the complexity, there's no one institution or no company that can really do this alone. And luckily with COVID, it would have been political suicide to not sign an agreement that would allow a vaccine to come forward. But there are many vaccines that sit on a shelf and aren't available because companies can't fight it out on the IP and reach an agreement, which is unfortunate, but it's reality. Was Tesla? Yeah. They were an investor in a small biotech company in Germany that developed some nanoparticles that CureVac ended up licensing. So, living through COVID, we've all sort of become vaccine experts because we've been the global guinea pig to make this happen. But some of the lessons were, there was a disease maybe 10 years ago called SARS that I thought COVID, in my opinion, I thought COVID for the US would be like SARS. That would be something that happened somewhere else and would stay somewhere else. And it didn't, but SARS was also a coronavirus. And so there was a lot of research done on SARS that was put on a shelf. And when COVID hit, they were able to turn that crank very quickly and use that technology for COVID. So that was good. The RNA DNA vaccines, because of how those are made with just short snippets of DNA, and because of COVID, companies have now built infrastructure that would allow them to do that with other diseases quickly and rapidly. So for the next pandemic, I would expect we would have a really robust response. One lesson learned is the RNA vaccine due to the cold chain. That's a problem. That's hard. That was a barrier to reach. We're the most advanced country in the world. It was hard for us, but we managed it fairly well. But you can imagine Spain, South America, Africa, those things didn't make it off the plane, and they were dead by the runway because they just didn't have dry ice and liquid nitrogen. So that was a real eye-opener for us. And the expense of it. Luckily, our government stepped in and subsidized it. We'll benefit from that now because the infrastructure for COVID is in place and other vaccines will benefit. Oh, should you get vaccinated? I will tell you all the places not to get resources. It's not Facebook, it's not Twitter, it's not the internet, it's not your neighbors, it's not Uncle Bob, it's not Jill, and it's not the news or the media. Really the only person who can give you advice is a licensed physician and your doctor, because they know your health situation and your condition. Now, I will tell you, I believe most doctors will tell you to get vaccinated, but it seems like after COVID, everybody's an expert and everybody has really strong opinions. And I would suggest that many of the sources of your information maybe aren't the best. And then final slide again, I think this group, because of polio, I'm probably preaching to the choir, but getting vaccinated is much more important than just protecting yourself. I get vaccinated because I want to protect the people around me. My mom and dad, my parent or kids, if I'm vaccinated and I'm not shedding stuff to other people, that's a good thing. You can create herd immunity. Vaccines are good for the old, immunocompromised and the young. And the more we're immunized, the less change there can be, which means we won't have to have variant after variant after variant. With that, happy to take any questions or comments. And if you think of something afterwards and want to email me, shoot me a note. Yep. So the question was, do kids in the US still get polio? I'm looking at Jill. I don't know. My kids are older. Our kids did 20 years ago. We have some nod. Yeah, yes.
Yeah, the reason I was asking is there have been, I know they're still vaccinating in Pakistan and Afghanistan because polio workers are being killed. And so with so much resettlement going on from some of those areas, is there a chance that polio could spread again if we're not getting vaccinated? But it sounds like we are, so.
Well, we are, but there is a general trend in resistance. There's a subpopulation of people that don't want to get vaccinated in polio because we in our country haven't seen or heard of it for years. people don't want to, but as an example, all of those military people that were deployed would be a great source to bring it back here. And at this point, we're likely all fairly naive because we haven't had it. So it remains important. Just because something isn't hot on the radar today doesn't mean you shouldn't get immunized.
I'm interested in the status and the challenges of controlling avian influenza, especially with the poultry industry.
Yeah, great question. So as you may or may not know, if you've been to the grocery store and figured out that chicken and eggs are really expensive, flu is a pathogen that it's called transboundary. It infects dogs, cats, chickens, humans, and chickens are one of the most susceptible organisms. Our country, and this is not a commentary, good or bad, but our country does not allow the vaccination of chickens against influenza because it messes up our import-export. So in order to export animals, they have to be tested and shown to be flu negative by antibodies. If you vaccinate them, they are flu positive. And so it's an import-export. And in our country, if a herd becomes infected, the solution is unfortunately euthanasia. And so a chicken barn may have 10,000 birds in it. And if one animal tests positive, those animals have to be euthanized, which is a real tragedy for lots and lots of reasons, ranging from animal welfare to food. The government is considering, because of the technology I talked about with Subunit and RNA vaccines, if we use those vaccines in chickens, we can now detect the difference between a vaccinated chicken and a wild type exposed. And so the government is under consideration to change their policy. And vaccine companies are actively making banks of flu vaccine for chickens such that if the policy changes, they can go to the field immediately. So, great question.
I realize I ask a lot of questions, but I'm an old speech major, so good speakers turn me on, okay? I apologize for listening to me, but I want to reinforce something Mike said about vaccines. Our daughter is a doctor in Denver, and she did her residency in Indianapolis. On Christmas Day one year, she was on duty in the hospital, in the children's hospital. She spent the day with a boy who was 12 years old, whose parents had not had him vaccinated for some disease, I don't know what. He had never left the hospital at 12 years old. I mention that in this group because in Denver, the most likely kids not to be vaccinated for the traditional diseases are the children of the faculty of the University of Colorado in Boulder, because they have some excellent, probably people who are, they know better how low the probability of getting diseases. Maybe they got a good statistic department, I don't know. So they don't have their kids vaccinated, all right? We're at Iowa State.
So just to add on to that comment, I do work at ChildServe and work with lots of children that are unable to get vaccinated because of various reasons. And so your contribution to herd immunity means a lot to the families and children that we serve. So thank you for that. But also wondering that time period for getting a vaccine approved, is that the same in the animal science world?
So the process is generally the same in terms of the studies we're done, but it is much, much quicker. So in the animal health side, I was able to get some things vaccinated in 2 years. I would say the typical range is 2 to 4 years. Certainly more concurrent effort happens in the USDA than it does the FDA. And so it is a much streamlined process. Yeah, so yeah, human vaccines go through FDA, Food and Drug Administration. Animal vaccines go through USDA. And they're actually regulated named Iowa. There's a center out by the interstate called the Center for Veterinary Biologics, who are the regulators of animal health. And to be honest, they're I used to complain about them a lot more when I was in the business, but they're actually really good partners. I mean, they really are partners to bring solutions for the animal industry. You know, they never move fast enough, but that's a tax issue. But they're really good people. They're really committed to quality and serving our industry. Yeah, all right.
Thinking about the food supply
Oh, there you go.
and also the agriculture of the country here. What's the status of the African swine fever vaccine?
Man, you have good questions. So we are still African swine fever free, which is positive. It has reached, it's a country that just had the big hurricane south of Puerto Rico. It's right off the coast of Florida. It's been detected, and it's, what was it? Dominican Republic, thank you. So it is in the Dominican Republic. And so there are feelings of not if we get it, but when, and whether we can respond appropriately. If we get it, and this is, I hate to be doom and gloom, it will devastate Iowa. 40–50% of the pigs raised in our country come out of Iowa. And once it's in a population, it kills everything in sight, and import export will just shut our industry down. So our government agencies, and not CVB, this time it's called NVSL, the National Veterinary Services Lab, we have a national surveillance program to try to prevent it from coming in. When you come to the airport and you fill out that little form that you get tired of filling out, much of that form is to keep things out like African swine fever. So we are monitoring it actively, but it is knocking on the doorstep. And another scary thing of this is they don't necessarily know who, but I think they probably suspect. There have been at least 2 cases of attempted, what we would call bioterrorism, where containers of infected pig carcasses were shipped into the US. Luckily, our Border Patrol caught it. But there are countries that would love us to have that because it would change our export status of pork. So it'd be a big deal for Iowa. Vaccine. There is a vaccine developed at Plum Island that is experimental, and there is a bank of it. African swine fever is extremely difficult to immunize against, and it changes rapidly. So the vaccine would probably prevent some animals from dying, but would not prevent the virus from spreading. So a vaccine itself would have limited, I mean, we hope that we don't have to use it.
My question goes back to the condensed time frame for the COVID vaccines. I noticed in there that all along their side you had in manufacturing.
Yeah.
How much does that process change during phase 2 and 3 when they've already started manufacturing? Is that and
Yes.
through the approval process, I guess?
Once you've done your safety study, your manufacturing is locked in stone. And so it's called the outline of production. But once, and it's basically a recipe, real complicated recipe, but once the recipe is written and you've demonstrated safety, unless you repeat that safety study, which nobody ever wants to do, that's how that vaccine is made for the rest of the time.
Yeah, the animal health world has been working with coronavirus for years, and I just wondered how much that really helped on the human side.
Yeah. The question was, animals have routinely have coronavirus and coronavirus vaccines, and he wondered if that helped. I'm sorry to say, because I was part of it, but most of those animal health corona vaccines don't really work very well. So it's disappointing. I mean, it was surprising. I said disappointing. When COVID, and Jill can tell you this, when people asked me early on if I thought a vaccine against COVID would work, I was really skeptical because most of the animal health corona vaccines are poor. And so it was shocking and very positive to see the quality of what we got on the human side. So if you're an animal, TGE, rotocorona, TGE, those are similar viruses to COVID. And if you have TGE and rotocorona, you'll know that you're still frustrated.
Mike, the ability for some of these new technologies to evolve and develop in the Ames area, you've been around the economic development effort. We've had, New Link Genetics, and I believe Merck now is doing a number of vaccines in their facility out here. What are your observations about the success of this kind of business expansion in this area of the country, particularly with the animal efforts that are going on?
Well, in my opinion, we are the mecca of animal health. Between NADC, Center for Veterinary Biologics, NBSL, the vet school, the Nano Vaccine Institute, Iowa State University, and this ecosystem we're the #1 producer of eggs in the country. We're the #1 producer of pigs in the country. Our workforce understands ag. And it's incredible. And there's a reason, Behringer Ingelheim has a castle out here, and Merck, Elanco's right up the road in Fort Dodge. But there's 2 or 3 things that really drive our growth locally. One is the culture and the ecosystem. We get hardworking farm kids from Iowa who get it. They want to work hard and they understand agriculture. Iowa State and NADC are incredible partners. I work with universities all over the world, and Iowa State would have been in the top 3 to 5 in terms of technology transfer. Their interest was to get it out and used, not to get rich themselves. And that's unusual. And then the third part is just, the funding through pork producers and USDA and NIH at Iowa State, there's so much technology available that we are in a very lucky and great position in central Iowa.
Mike, could you give us an understanding of you? How did Mike arrive at that degree and that interest? I just want to know the backstory.
Oh man, Jill, you might have to leave the room. Yeah, so I grew up in Knoxville, Iowa, a little small town, home of the mullet, and came to Iowa State with the full intention to get as far away from ag and animal health as I could. And every step of the way, it just sucked me back. I mean, harder and harder until I gave in and figured out that's what I was meant to do. I worked for, many of you probably know, Dr. Jim Roth. I was a graduate student of Jim Roth's. And during that time, was fortunate enough to develop a salmonella vaccine for pigs. And a small little company called Noble Laboratories up in Sioux Center, Iowa, got that license. And I was kind of the luggage that went with it. I don't think they could really get it to work. And so I was a cheap graduate student, so they hired me, and which was just a phenomenal experience. It was a small private company and great family values. And then they got gobbled up by Behringer. And again, at the time, I wasn't so sure that was a great idea, but Behringer provided me 25 years of the most amazing experience I could have ever had. So that's the short version.
Okay, thank you so much. Let's give it a round of applause. Thank you so much. Wow. I didn't only just have one takeaway from that. I had many, and pronunciations as well. So thank you. As you know, we're the lead sponsor of Raising Leaders in Story County. So we'll have you autograph this before you leave. And also, I know we were kind of cutting it short on time. So if you do have another question, maybe tag him or chase him down after after we end here, and he can maybe answer it for you. Please stand for the 4-way test. The things we do and say, is it the truth? Is it fair to all concerned? To all concerned. Thank you.